Hello, everybody. Welcome to the Office of Dementia Services 1 year birthday session. My name is Jennifer Craig, and I am the director of the Office of Dementia Services for the state of Kentucky. I work with the Department for Aging and Independent Living. That's also sometimes referred to as DAIL. We get called all kinds of things. In the world of state government, we use a lot of acronyms, so I'm going to try not to use those acronyms today. But if I do and you don't understand what that acronym is, please use the chat feature to say, hey, Jennifer, what does that mean? I don't know what DAIL stands for. But thank you for joining me today and listening to what Kentucky is doing for individuals with dementia and also their caregivers on this very personalized journey. But before we get start talking about all the things that Kentucky is doing for dementia, I always like to start with my why I am so passionate about this office and why I'm dedicated to making these differences for the caregivers and the individuals living with dementia. So on my screen, this is my why. This is Staff Sergeant Hurley Cleston Craig. You're going to hear me refer to him as Clessy. And if you've ever met me and you've been to any of the things that I talk about, you will hear a Clessy story a few times. But this is my why. This is my father-in-law. So Clessy was born and raised in a small town in Kentucky. He was a Korean War vet and a father of 6, an award-winning coon hunter. And from what I've been told, he was the best tobacco farmer around. I really did consider this man a real-life Davy Crockett. So Clessy was diagnosed with vascular dementia in 2010. And overnight, all of our lives changed. He lost his independence, his memory, and my husband and I became full-time caregivers. One thing we did have in common, all of us was confused and we had no clue what to do next. Looking back, I can see where some of these cognitive changes were happening. But I am telling you, from a caregiver's perspective, while it was happening, I didn't think any of those changes were significant. But that's one of those things where we didn't slow down and we didn't stop and look. So Clessy died within 18 months of being diagnosed. I still have a hard time thinking that that wasn't actually a blessing. He did not have to live with dementia for as long as other people do. I remember how confused I was about the whole entire thing, not knowing what to do next, what was going to happen to us, what was going to happen to him. And we all felt isolated and alone. I remember him sitting at our table right after he got diagnosed, and he looked straight in my face and he said, Jennifer, tell me what's going to happen to me because I know you won't lie to me. That was one of the hardest things that I ever did, but I let him know everything I knew. And the things that I didn't know, I figured that out. I went and I looked it up. I went to work and started asking questions, and I came back to him and I gave him everything from start to finish, what to expect. This is what I hear all the time, though, from caregivers and people who are living with this disease. They don't know what to do next. So now I want everybody to use the chat button. I hate being the only one talking, and I usually call people out while I'm in the room going, hey, you in the back. But this is where I want everybody in this meeting to use this chat button. And I want you to share with me your why. Why are you here? Do you have a dementia story? That's another thing that I have found with the Office of Dementia Services. When I go out and I talk to people, everybody has been connected to dementia at some way or another. Was it a grandparent? Was it your favorite resident when you worked as an undergrad at a long-term care facility? Was it a parent? Are you experiencing your dementia story now? I've realized we all have that one thing that has touched us in a professional or personal level. Why do you do the things that you do? Why are you here at the conference today? Why did you apply for your current position? And why do you come to work every day? So go ahead and use the chat button. Share with everybody your why. So while everybody is sharing that, I'm going to tell you Kentucky's why. Why and how did the Office of Dementia Services get started in Kentucky? And how did it get to where it is today? So Kentucky is known as being one of the least healthy states in the nation. But Kentucky is now one of 15 other states that has an Office of Dementia Services and a coordinator to make sure that we address the challenges that someone who diagnosed might face, but also those caregivers. So these are the Kentucky 2023 Alzheimer's statistics. The CDC estimates that there are 5.8 million people in the United States with Alzheimer's or related dementias. That includes about 200,000 individuals under the age of 65. So in 2020, 75,000 individuals over the age of 65 were diagnosed with Alzheimer's in Kentucky. This number is expected to increase to 86,000 in just the next few years. So one of the things that I always point out with this slide is that is diagnosed with Alzheimer's. Alzheimer's is just one form of dementia. Klesse had vascular dementia, so he wouldn't be recognized in this 75,000 number. Alzheimer's is the 6th leading cause of death in the state, just under strokes and diabetes. We're going to go a little bit in a few more slides about the caregiving, but I want you to look at the caregiving numbers. In 2020 or 2022, 157,000 caregivers provided 302 million hours of unpaid care at a cost of over $4.8 billion. Another thing that's interesting on the slide is in the state of Kentucky, right now, there are only 39 geriatricians in 2021. There are, just to put that number in a little bit of perspective, there are over 700 pediatricians in the state. Geriatricians are those medical doctors that are trained to meet these unique needs of older adults. They can treat these multiple chronic conditions and manage multiple chronic conditions and understand from an aging perspective. That is why it is so important. The increased need to meet the demand in 2050, which is only a few years away, by the way, a 430% increase to meet the demand of what dementia is going to do in the state. So I always talk about the caregiver because that's the part that I can feel, right? I was that caregiver. So I already told everybody about the 157,000 unpaid caregiver hours. But here's something: 65% caregiver has at least one chronic health condition. 40% suffer from depression. And 21% state that they, as a caregiver, are in poor health. A couple more statistics that aren't on here. 26% of those were female. 21% are over the age of 65. So over the age of 65, typically with chronic conditions themselves, and female, which is a high risk factor for dementia, are all taking care of individuals. 31% are taking care of their parents. 19% are taking care of their spouse. That's that caregiver burden. dementia affects not only the person that has been diagnosed with dementia, but it also affects that caregiver. So we've got to take care of both. We've got to come at it from every factor. Another statistic, the primary diagnosis of the care receiver. Caregivers are taking care of people for more than dementia. And why does that matter? So this is where I'm going to ask you to use that chat button real quick. Why do you think that the primary diagnosis of the caregiver, the COPD, the diabetes and heart disease, hypertension, why does that matter? Why is that number so important? I'm going to go ahead and go on. This is why it's important, because most people with dementia also have comorbidities. So they're already fighting diabetes. They're already having strokes and other cardiovascular diseases. They have the high blood pressure. By the way, high blood pressure is a leading factor to stroke. Stroke is a leading factor to vascular dementia. Again, that is what Clessy had. Also, something I didn't say when I had my Clessy slide, he didn't even know he had a stroke at any point in his life. We found out he had a stroke when they did the brain scan, when he started having memory impairment and being diagnosed with vascular dementia, that they said, oh yeah, by the way, a couple years ago, you probably had a stroke. And his response was, it might have been when I fell out the barn. But the comorbidities amongst dementia patients, that is why that slide is also so important. Because although 28% Caucasian, 18% of African American caregivers have stated that they are taking care of someone with Alzheimer's disease, spina bifida, all that, they're also taking care of someone with heart disease and COPD and diabetes, which could also merge into Alzheimer's disease later. So that is why that slide is so important. Experts believe that individuals with dementia are at a greater risk factor for certain health conditions as compared to those without dementia. These commonly include the high blood pressure, the stroke, the cardiovascular diseases, diabetes, mental health conditions like depression, and Parkinson's. But these comorbidities may also be targeted to prevent the onset of dementia in the first place. So if they're getting the proper treatment while they're being cared for diabetes, maybe it will not progress into Alzheimer's. If you take care of the diabetes in your 20s, maybe you're not going to have the risk factors for diabetes later, and then that comorbidity in turn for dementia. Racial and ethnic differences in the prevalence of Alzheimer's and other dementias. Studies have also indicated that older African Americans are twice as likely to have Alzheimer's or other dementias as Caucasians. Some studies have even indicated Hispanic adults are about 1.5 times more likely than Caucasians to develop signs and symptoms of dementia. And the differences in social and physical environment by race and ethnicity across your life course increase those risks for chronic conditions that are associated with the higher dementia risk, such as cardiovascular disease. That's a common reference on each of my slides, by the way. So African Americans' health disparities, 44% are more likely to die from strokes. 10% of Latino Americans are more likely to die from strokes. Again, stroke is a factor to vascular dementia. So why is that important? Okay. And this was one of the most shocking things when I got this position. Within 6 months, this report came on my desk and they said, okay, what's Kentucky's Office of Dementia Services going to do? In Franklin County and Mercer County, they have been deemed number 2 and number 16 in the nation, not in the state, not in the region, not in a 4-state cluster, in the nation for having ADRD prevalence among African Americans. Okay, that is big. That Franklin County is in my backyard. We've got to do something. We've got to figure out what to do, how to do it, and take care of this situation and not be number 2 and number 16 in the nation. So another statistic that I like to share is, although deaths from major causes have decreased significantly or remained approximately the same, official records indicate that the deaths from Alzheimer's disease has increased significantly. Between 2000 and 2018, the number of deaths from Alzheimer's disease is, as recorded on the death certificate, has more than doubled, increasing to 146%, while the number from deaths from certain causes, like heart disease, has decreased. In 2019, over 1,600 Kentuckians passed away with an Alzheimer's diagnosis. By the way, that's very Alzheimer's specific. It's not dementia specific. We are in the process, and I'll talk a little bit later, we are in the process of trying to figure out how to record that data so we can gather these other forms of dementia and start putting those numbers into these slides as well. So, in the words of the Grateful Dead, what a long, strange trip it's been to get Kentucky to where it is right now. So the numbers have been there. The data really hasn't changed. It goes up a little bit, very seldom goes down. So real quickly, in the year 2000, Kentucky created the Alzheimer's and Other Related Dementias Office, and it also created an advisory council about the same name. During that time, Kentucky realized that there was a need for attention to dementia and a need for a dementia state plan, but it lacked the funding and the staff and also the mandates that could make it happen. So it just kind of sat there and it rested and it waited just patiently, just chilling in the background until 9 years later, in 2009, the first Kentucky State Dementia Plan was drafted. Thanks to the help from many within CHFS and Dale and the Alzheimer's Association, this plan outlined what Kentucky needed and gave recommendations on how to make the changes to benefit those with dementia and start creating the supports and the services to connect the dots. But like in 2000, it lacked the funding and the staffing and the mandates that could make it happen. So it again just sat there and it rested and it waited patiently until 2017, when grant funding was secured to update the state plan. However, that update was essentially just a reiteration of all the 2009 plan because the needle hadn't moved very much. And all these recommendations were made, but nothing was really being done to move that. So again, dementia rates continued to increase, but the dots couldn't be connected because, you probably guessed it, funding and staffing. But don't get me wrong. Things were being done. In addition to all the other duties assigned by Dell staff and the help from all of the ads throughout the state of Kentucky and community providers, things were being done, but there wasn't the focus and there wasn't the time that needed to make this thing blossom. So, like all good things, you must wait, right? But guess what happened next? Senate Bill 74 was introduced in 2021, and that's when something big happened. That doesn't happen very often. The bill received unanimous support from both the House and Senate, and it was signed into law by Governor Beshear in March of 2021. But what did that mean? We've been chilling for the last 20 years. what does the Senate bill do? Well, the Senate bill renamed the Alzheimer's disease and related disorders to simply the Office of Dementia Services. Thank you for that so much, because I get tongue-tied every time I try to say that big long name. It also updated the responsibilities associated with the office. It changed some of the membership in the advisory council and now includes important voices from both the industry and consumer advocates, as well as representatives and various parts of the cabinet for health and family services. But it also did some cleanup to ensure that the state plan must be updated every 4 years. So although it was a really good dust collector for all those years, now we've got to dust it off every now and then, and we've got to update it every 4 years with a whole new one. But it does have to be an update annually, but a full update every 4 years. And finally, it established the coordinator position to build the foundation of the office and keep it moving forward. So the position was established, but without funding. So right now, we're using grant funding and some ARPA funding to keep this office going so it doesn't sit there for another 20 years. And as of October 21st, Kentucky hired their first Office of Dementia Services coordinator. So in 2022, we celebrated our first birthday. So what we've done in just this year, and I'll go over it a little bit more throughout the slides. So the coordinator works with the Alzheimer's Association to oversee policy implementation. We're putting the dementia flair on policies. We're fighting for workforce development. We're fighting for increased dementia awareness throughout the state with partnerships with public health. We've developed card work groups, which I'll do that acronym here in the next couple of slides. We've also organized and provided dementia training opportunities. And we've initiated the Bridging the Gap grant. And we're applying for other grants. Again, we'll talk about in the next couple slides. So as the Office of Dementia Services coordinator, I really think we need to do a holistic renovation of the Alzheimer's and dementia services and supports. We must visualize the big picture and how to make the changes that will positively impact Kentucky. But how do we start, and where do we start, and what can we do? And with limited funding, there's all these questions. Why? But what we've got to figure out, what services do we have in place and what services do we lack? What do our care organizations look like? Where are there gaps in the community? And what is, most importantly, what is guiding Kentucky to recognize and implement the changes that we need? And who are we doing this for? What do we need to make changes to create the services to figure out dementia and how to connect the people as a state? So one of the things that we did in the past year is we've established card work groups. So that's the Kentucky Alzheimer's and Related Dementias work groups. I realized really quickly that I could not do this alone and that I needed to build a team of people throughout the state to share what is working and what is missing in the different regions. Really, teamwork and working together is the only way that we can move these dementia issues and topics and identify things that are needed. So, oh, here we go. I got all excited. Some of our members that are on the CARD collaborators, we've got individuals from the University of Louisville Traeger Institute. Sam Cotton sits on a couple of them. Anna Fall also. neuroscience, public health, Sanders Brown, Department Bluegrass Care Navigators, Alzheimer's Association, Long-Term Care Ombudsman, Office of Data Analytics. We are really putting all of the pieces together, all of the heavy hitters in this world, and we're all talking together. We have bi-monthly meetings. They last about an hour. They're all a lot like my presentation today. We have conversations with each other. We talk about the topics of the day, and we hash that out. Sometimes we get things accomplished. Sometimes we have just really good conversations about a topic. So many people reached out to me when this office got established, and they wanted to know, how can they be involved? How can we do this together? And this is what was created. So these are each of the card work groups. So if you're interested in it, please reach out to me after this meeting, and I'll send you out an interest form. It's really easy. And just say, hey, Jennifer, I'm really good at this policy world. Maybe I can be on this work group and help put this dementia flair on policies. Hey, Jennifer, I really look into that public safety and want to see what I can do there. But some of the things that our card work groups are doing, the service delivery, we're looking for services and service gaps throughout Kentucky. But we're taking it from that patient and caregiver perspective. So in this last meeting, we divided out into the different regions, and we, as a caregiver who was just taking care of someone with dementia, what did I need? So we tried to figure out what was out there. We also made recommendations on what was missing and how they could access those services. So in the healthcare and insurance, that was a really good conversation. And if anybody sat in on yesterday's general session with Dr. Jaika and heard about the new healthcare treatment or the dementia treatments, we spent a considerable amount of time on discussing this treatment and how the hospitals, how the clinics, and how Medicare is going to pay for these with this increased demand for MRIs, for the medication itself, for transportation to and from the centers to get the treatments. So we're having those conversations. By the way, that's a really awesome conversation to have because we are on the cusp of something big. The Data and Research Committee, we're working to build that data infrastructure. And it surprisingly, it's not there right now. So we're building it to get that data to the people, to the legislatures, to be included into grants that show where Kentucky stands. One of the coolest things, and this stems completely from my ADRC background, is what we're doing in the outreach and partnership. So when someone has a dementia diagnosis, one of the first things that they do is, what do I do next? Or that caregiver is, well, what about this? And where do I go for this? And what was lacking in the state was a dementia resource guide. So with our card work group, we are creating a dementia resource guide with all of the resources out there for dementia in the state. The guide will be electronically. So we've decided that we're not going to do a lot of printouts because things change every day. So it will be free to get and then print out on demand to give to someone who is in your office calling you about somebody who was just diagnosed with the dementia. And it really does start as that resource to help them understand what's happening and also understand where to go to get the services and supports that they need. but these work groups are only as good as the people that make them. So if you are interested in any of these work groups, please let me know. Please send me an email at the end of the meeting. Please put it in the chat. Hey, Jennifer, this sounds pretty cool. I try to make it where we meet for an hour and then you don't have to think about it until the next meeting. That's why we hash everything out at that meeting. But that is what's really moving this needle. Even though the Office of Dementia Services is an office of one with all of the stuff to build, I can't do it alone. That is where these card work groups come on, because these things are being created because of everybody's help. That leads me into collaborations and partnerships. I can't do this alone. I have ideas. You have ideas. We come together and we have the best ideas. So these are just some of the people that have helped the Office of Dementia Services in building this 1 year of operations. They're huge. And again, I couldn't do it alone. One of the coolest things that we did, because the Office of Dementia Services coordinators, they're kind of new in the nation. Like I said earlier, there's about 15 of us in the nation. It's growing, which is needed, because dementia is not region based. It's not, just sitting here on Kentucky. But one of the coolest things is now all of the coordinators across the country are getting together and talking about what dementia looks like in their world, what they're doing with dementia. Some of the established coordinators are sharing with us their ideas and what's worked and what hasn't worked, so we don't have to start from scratch. One of the simplest things was part of my advisory council. We had to establish bylaws. Well, okay, I can establish a bylaw, but exactly where's some help here? So I reached out to a colleague in Georgia who shared with me their bylaws. So we really are coordinating together, because we have to build these partnerships. We have to build these teams. Talked a little bit about the data. So my previous slides were data heavy. I hate throwing the data out there, but I have realized if you don't see it, then you might not realize just the significance. So part of the data work group and part of the importance of data for the Office of Dementia Services is how can we move forward without the data that identifies where we currently are and what helps us set our goals for the future. Currently, dementia data is limited, very limited in the state of Kentucky. So I remember early on, somebody reached out to me and wanted to know if there was county-specific dementia data. Well, I said, oh, sure, probably. Hold on, let me see. That shocked me early on. As of right now, there is not county dementia-specific data. That is something that's needed. We need to know how many people in Trimble County have dementia. Yes, Sam, that was probably you. I think it was, actually. But I've not forgotten that, because I was so shocked that it wasn't easily accessible. And everybody, you put data in. Data entry is a big part of people's lives, but where does that data go? Why can't we share that data? So that huge thing, definitely trying to figure that out. The data work group teams is working together. Something that's really cool and it's on the horizon is we're working with the Office of Data and Analytics to start getting I think it's a quarterly, I think it's called the Schedule K. and that is hospital records of inpatient and discharge with specific diagnosis codes. And I think we have put up, probably about 17 that tries to tackle all forms of dementia. If they had insurance, what type of insurance, how much their stay cost. But one of the coolest things about it was their county. So here in the next few months, we will start having that county-specific data, along with all this other data that can help build grants, that can help figure out the gaps, to help just see how prevalent dementia is in each of the counties. Another thing that the office has started doing is, for the first time ever, public health and the dementia information is going to be included in public health state improvement plan. It's called the SHIP. So that's going to take that public health perspective and throw dementia data into the viewers. So the dementia state plan. So that's one of those things that we have to recreate every 4 years, update every year. So throughout 2022, the Office of Dementia Services has worked with the Advisory Council and the cards to help move these things from 2009 recommendations to what Kentucky needs. What has it done? What doesn't need to be done anymore because it's just not a problem anymore, or the problem has changed. I never want to say that the problem's not anymore. Problems seem to morph into other things. So how has that initial recommendation changed, and how do we need to change the way we approach it? So one of the coolest things that I did was I distributed all of these recommendations that had been sitting there for the last 20 years into the card work groups. So all of the recommendations that revolved around the policy world, that got moved into the policy work group. So the people that are policy minded know how to tackle that. So I'm chunking it off. All of the things that were data, that got moved into the data work group. So that group can start piecing this out to see how to move these needles. But also with the dementia state plan, is we're talking about the things that need to be included. One of the new things that will be included is treatment. I can't say that enough. We've had these suggestions of these miracle treatments in the past, but this new treatment, I think it might work. It's there on the horizon. But as a state, how is Kentucky going to help with tackling, everything revolving this new treatment? So treatment options, that will be in the new state plan. So each state, and Kentucky's not alone, they use this state plan to identify and put into the universe the gaps and the needs for the state specific plan, what their recommendations are, and how it can lead and be tailored to policies. This is what the legislatures like to read. Okay, this is what drives them to making the changes that we in the community know are needed. And this is also a place where other community members can provide this input and this feedback and their recommendations, because it's not just one person alone. It really is a statewide effort. So I talked a little bit earlier about the funding. I always like to throw this out there for anybody who's listening. The Office of Dementia Services, and the previous name, it sat there for 20 years because it didn't have the time and it didn't have the funding and it didn't have that dedicated position to help move that needle. So how can we prove something when we don't have the person in place to help prove it? So that is why funding for this position is so important. And establishing that Office of Dementia Services coordinator and putting that into a line item in Kentucky's budget. We can figure out how to make this happen. You know, we've got it funded for a few years through ARPA and an ACL grant. We can figure out how to make this happen, but it really does need to be a line item in Kentucky's budget. So now I'm going to talk about some of the grant opportunities. Grants are how we can change the world without money of our own. Grants are what helps our visions and ideas become a reality. And grants can provide valuable resources for us to carry out projects and provide services that we would not be able to. So one of the grants that the Office of Dementia Services has, it's an ACL grant, and we've named it Bridging the Gap. So in July of 2021, the state was awarded a $1 million ACL ADPI grant. But with this grant, we've created Bridging the Gap. So what Bridging the Gap is referring to, it's that space and time between the time that someone applies for a Medicaid waiver program and the time it takes for them to start receiving the services. I think everybody on this call has heard of this gap, that the time that it takes for someone to start the Medicaid application who needed services that day, they actually needed services probably 3 months ago, but they were too busy to call to start the process. This is how they can get services starting day one. So while those individuals are applying for Medicaid, they will be eligible to receive up to $2,500 to help pay for services that they need, Medicaid type style services. So this is where they can pay for respite. This is where they can pay for adult day. This is where they can pay for attendant care services while they're in that limbo period. But I said earlier that it's a twofold. It's not just the person with dementia, it's also that caregiver. So we can't forget that caregiver. So that caregiver of the person who's applying will also receive caregiver training. So it's a program called Reach Community. I'll go into a little bit in the next couple of slides, but it helps that caregiver identify how to take care of themselves and how to be a better caregiver with someone with dementia. So these are all things that this Bridging the Gap program is set to do. Right now, Bridging the Gap is offered at Buffalo Trace, Bluegrass, Green River, and Pennyroyal. I'm hoping to expand that in the very near future. So if you would like this in your area, please reach out to me. Please reach out to your local ad. We are working with the AAAs to implement this, and it really is building. They're already we're working with the ADRC and their caregiver program to help do this program. We also just submitted an application for the CDC BOLD grant, building our largest dementia infrastructure. So this grant, we should hear something by September. This was my first grant I ever wrote. And I've heard that CDC grants are one of the hardest. So why not just start with the hardest and then everything's easy from then on out. But this is working with, we are collaborating. The Office of Dementia Services and the Department for Public Health are working together to really build a dementia infrastructure from a public health perspective. All of the data that I gave earlier with the comorbidities and the connection with dementia, those are things that are important in the public health world. If we get the proper education the proper treatment, the focus at the early onset of all of these, it will affect dementia diagnosis in the future. Another thing that the BOLD grant sets out to do is education. Not only health education, but it's also that educating healthcare providers on how to make the diagnoses, when to make diagnoses, and how to remove that dementia stigma that's out there in the caregiver world, in the community world, but also from a healthcare perspective of giving the person that diagnosis. So I'll keep everybody posted about the BOLD grant, fingers crossed. So dementia training. I'm good at this. This is one of those things that I'm pretty good at. And this is one of those things that I knew as a caregiver that I needed and that the state was lacking. So nationwide, up until just a few years ago, dementia state training requirements were minimal. So we really do need to improve the state training requirements to everybody who works in the dementia world. But we also need to take care of those caregivers and provide caregiver training. Caregivers need to take care of themselves. Caregivers need to make sure that they know how to alleviate the stress. Caregivers also need to learn how to be a caregiver. My husband did not know anything about dementia until Clessie moved in with us. I had previously worked at a long-term care facility, so I wasn't as clueless as he was. But that is something that a lot of caregivers, they're just kind of thrown into. They don't know how to provide that proper care. So, and next thing you know, they have to. And usually they're doing it for someone like their parent, which is a whole different aspect. So that training is needed, that encouragement is needed, that conversation is needed with that caregiver. So some of the ways that the Office of Dementia Services has started tackling this dementia training is we're doing dementia education webinars. We have had over 800 attendees in our 4 webinars. Our next one is set for June 20th. If you're interested in that, please reach out to me and I will send you the registration form. It will open around June 1st. Our next one is Managing Money, and it's the Caregiver Guide to Finances. I am also working with the Alzheimer's Association to set up next year's education webinars. They are 1-hour virtual webinars that you can just pop in and pop out and get tons of information. And a professional, a caregiver, it's open to anybody. So if you already know about it, please keep joining us. If you've never heard about it, let us know. But one thing I would love for everybody to do is promote this in your communities. Put this in church flyers. Put this on community billboards. Get this out there to everybody who needs it. We're also providing that caregiver training, so that Reach Community. That is a 4 1-hour phone session that is provided with caregivers that really puts that individual touch. It takes care of it. It talks to that caregiver where they're at, what issues they are experiencing, how to cope with those issues right now, how to take care of themselves while they're doing it, how to build the skills to help as a caregiver. So Reach Community is available in the community in the regions that are doing the Bridging the Gap grant, but that is also something that the office is looking to expand throughout the state. Dealing with Dementia, that is a 4-hour work group specific to for caregivers. I did my first one a few months ago with 7 caregivers. I keep it very intimate because We need to be intimate for a minute. We need to have those conversations. We don't need a big classroom setting. It was moving. I left that session feeling what I needed to feel. I felt like I helped a lot of caregivers connect to resources, but also to listen to them and to understand and to help them figure out their next steps, how to have these conversations, how to have conversations about how to prepare for the holidays for themselves and also for their families. So if anybody is interested in doing a Dealing with Dementia workshop with me, please let me know. Right now, again, they are annually at each of the 4 participating Bridging the Gap regions. But again, that is something that is going to be offered to all of the ads, all faith-based organizations, all communities and senior centers. I can come to you. It will be me, and I'm telling you, it will be memorable. One of the coolest things, the Jennifer Craig touch for people that have worked with me, is a virtual reality experience. So it was last week, I was at a conference. I worked in the exhibit hall, and I brought my VR headset, and it allows the wearer to have a 4-minute experience into the life of this lady walking down the street with her son with dementia. It was powerful. Everybody who took the headset off, they were speechless for the first couple of seconds. But they came back to me and they said, Jennifer, I didn't realize what blurry was until I experienced it. And another one was, why did it cut in and out? I couldn't hear, because you are living in the life of someone with dementia who might only be hearing 2 or 3 different things. It was moving. So again, any exhibit table that I will be at, I will have my awesome cool VR headset available. If you would like for me to come and bring my VR headset to any of your meetings, any of your board meetings, any of your advisory council meetings, anything like that, I would love to share this virtual reality to anybody. It really does. It packs that impact. So we also, in the dementia training world, we also do curriculum review. I'll go into that a little bit later. We also, for the first time ever, have a training resource list. That is a list of Office of Dementia pre-approved dementia trainings that can be incorporated in your entities. So that leads me to workforce development. So in 2021, Kentucky also passed Senate Bill 61, which made dementia training mandatory for all direct care staff in personal care homes, assisted living communities, and home health care. That passed in 2021. The requirement for all of these entities to be dementia trained. They have to have, all direct care staff have to have 6 hours of initial dementia specific training and then 3 hours annually. When I took this position over, I was surprised that it wasn't already there, that it took a Senate bill for 2021 to start this. So we have to increase Kentucky's dementia capable workforce. So the office has included within Dale's fiscal year 23 home care and Title III contracts that all employees, including case managers and those employees who interact with the community, to have at least 1 hour of dementia-specific training approved by the Office of Dementia Services. It's a lot lenient than the other requirement, but this is just so we get the workforce knowing what to see out there. I worked at the long-term care facility many moons ago, and I can't remember any specific dementia training. it's needed. It's needed for not only the people who are working with patients that have the diagnosis, but I think the police, the state troopers, the police, the firefighters, the transportation providers, the restaurants. Dementia Friendly Lexington is doing an incredible way to promote dementia friendly into the restaurant, and the another one is like the beauticians, how to have a dementia friendly approach, and how to have those trainings. So developing that workforce with that dementia flair. So I love this picture. We will find a way, or we will make one. And if anybody has worked with me in the past, you will definitely know that I'm always up for a challenge and I will make it happen. But what do you think is missing in Kentucky? What are some of the things that you think that your agency or where you're working is doing correctly? How can we take what you're doing in a community and make that a statewide thing? What are your agency? What is your community? What do you think that the state is doing right for the dementia, people with dementia and their caregivers? But we will figure out a way to make it happen. One of the things that I love, and when I first started, was I have my wish wall. And anytime I do these things, I tell everybody to send out their dementia wish. And it gets sent out into the universe, then it gets printed out and put into my wall. So when I see it, I can start connecting the dots, because if you don't say it out loud, it's not going to happen. Your idea and your suggestion is just as important as anybody else's, but if it just stays in your head, then that's where it's going to stay and it'll never become a reality. So any suggestions that you have out there, please send it out to me. So I do want to mention that this really is a team effort, and together as a state, we can make these things happen. The world of dementia and Alzheimer's is changing, and I really want to make not only the Kentucky's dementia state plan, but I want dementia to become modern for the state of Kentucky. There's a new generation of caregivers out there. There's new technology like the VR. There's new medications, new ways to help individuals age in place the way that they want for as long as they want. I want to thank you for coming to the session today. And again, always feel free to reach out, give me a call, give me an email with anything that you have. I think we still have a few more minutes. So if you have any questions, you can use the chat button.
Jennifer, I think there's a couple of things early in the chat that I want to call your attention to.
Okay.
Stacy Phillips asked, why do you think we have very few geriatricians? What can we do to increase the numbers?
I do not know why we have very few. That is something that we are working with our card work group to identify and also figure out how. Sam, in your world, do you know why there's not so many geriatricians?
Well, I think it's a combination effect here in Kentucky, in my humble opinion. I think we're a very rural state. And so most of our geriatricians are concentrated in our urban areas like Lexington and Louisville. I would also say across the board, not just within the medical field, but within other professionals going into the field of geriatrics, we have a limited workforce as well. And quite frankly, it has been for a long time, a lot of students in the field, then going out in the field who are studying different programs, don't find geriatrics to be very sexy. Right. They want to work with kids, or they want to work with, adults. And so we need to get rid of that kind of perception of what geriatrics is, and really reframe the wonderful body of work that we know that you can engage in as a professional out in the field. That's just my humble opinion.
Yeah. When I was doing this presentation, I'd seen that number and I knew geriatricians were limited, but I wanted to see how many pediatrics, because man, everybody wants to be a pediatrician. That's fun. But you said it right. Aging and fields related to aging, it's not a sexy field. It's a needed field. Everybody ages.
And I see a question from Jessica. With so much needing to be done, it can be overwhelming. How do we as professionals get the best start in the right direction? What should we focus on first? Education and awareness?
So, Jessica, that is the question that I've asked myself every day for a year and a half, is where do you start? I started by breaking off into those sessions. So just like what you just said, education and awareness, I broke those off into my work groups. So you have to start somewhere. My suggestion, where are you passionate? Where does your heart lie? That will send you in the right direction, and you can tackle all the other things later. But I'm a huge proponent for dementia education, dementia training, just because I know that is lacking. When I was a caregiver, I didn't know where to go. Also, those resources. So I hope that answered your question, Jessica. Start where your passion takes you. Are there any other questions in the chat, Sam?
I'm just looking. I see Sandra put, providers have also indicated that payment reimbursement in geriatrics is an obstacle for going in the field as well. And I totally agree with that. And then I see another one from Stacy. How can we help get the funding in the Kentucky line budget?
Talk to your legislatures. Totally promote the importance of having the Office of Dementia Services. And why it's needed. I am trying to prove that in the year that I've been established with my legislative report. The first year, it was about a page and a half. This legislative report that I sent in November was 14 pages, showing what the Office of Dementia Services did in 1 year. So contact your legislatures. It really is. We've all got to fight for this.
Well, thank you, Jennifer, for such a great presentation.
No problem. Thank you. And anybody who has any questions, please, again, reach out to me if you want to be part of the card work group. That is really how we can start as a state moving dementia forward, moving that needle.
Yeah, thank you. And I know you had on your last slide your contact information, but I also put that in the chat too.
Okay,
because somebody was asking for it.
Thank you, Sam.
All right, thank you.